Well, just following up on treatment, and are you heading in the right direction? Because it's half science, it's half art, and the body's too complicated. So if you're not staying in touch, that's why I started that program. It's like people would come in and then they disappear, and we lose track, and I particularly lose track.
Yeah, right.
But you have to maintain consistency. And I just have people that say, when I notate what I'm doing, it's amazing what I learn about myself. And I think that's the biggest thing, just carving out the time yourself to focus on what you're all about and what you need to do and staying consistent. Like we have a timer on our clock, 7 p.m. to take our cod liver oil, because we find out most of the time we forget.
Yeah.
So now at 7 p.m. it beeps. And then we say, tomorrow. So anyway, everybody knows Dr. Michael Carter, and he's going to talk about his journey into functional medicine and to solving his own 30-plus year glaucoma problem. So Dr. Carter, without further ado, you're on.
Okay, so I started out in anesthesia back in 1992. And that's actually when I got first diagnosed with glaucoma. And mine was an unusual presentation, but I would say lucky for me, because most people don't actually have symptoms. And I actually had pain in my eye. So it was like a headache in the eye. So consequently, going to the ophthalmologist, seeing what's happening. And at that time, I really didn't know that my family actually had a family history of glaucoma and so forth. But at any rate, found out that my pressures were like 50. And normal is somewhere in the 18 to 20 range. So was put on, eye drops and so forth. And that brought the pressure down to normal, and really never suffered from that. I ate again for quite some time. And then when I was practicing in Las Vegas, probably around 10 or so years later, maybe 12 years later, had the eye pain return. The medications weren't working. They put me on more medications, for the eye drops and to keep the pressure down. And ultimately I had to have surgery in both eyes. So I had the trabeculectomy. Basically they're punching a hole in the eye to kind of relieve the pressure. Unfortunately, I had a complication on one of my eyes, on the left eye, and the pressure went too low. It's called hypotony. So I lost most of the vision in that eye, and the right eye was still perfect and so forth. And then that's when I decided to retire from anesthesia, and then went into like the medical spa arena, where I was doing bioidentical hormone replacement and a lot of aesthetic stuff with lasers. Then I actually trained to become a cosmetic surgeon to do liposuction and fat transfer techniques. And I was working with another physician where we worked in tandem, and that worked out very well. Had very successful practice for about 8 years.
Michael, let me interrupt for just a second. That hypo thing from the poking in the eye, was that an iatrogenic? Was that a medical error?
Yeah. So, and that is a consequence of having a trabeculectomy. So, of course, they let you know these things in the fine print, but yeah. So, I was determined to, continue practicing in the medical realm, in spite of that. So, again, did very well with the cosmetic surgery practice. Had about 7 clinics between Georgia and Florida. Also during that time, I also trained at the American Academy of Anti-Aging Medicine to do stem cells. So I did the first stem cell fellowship probably about 14 years ago. So when I was doing the cosmetic surgery practice, I could also do stem cells treatments on, you know, a certain select number of individuals as well. And of course, during that time, that was one of the things that kind of came out during my training that could potentially be beneficial for glaucoma. So of course, you know, I had my own stem cell therapy and got, I say, pretty decent improvement, but it wasn't long lasting. So over the years had, you know, subsequent stem cell injections, both intravenously, did have umbilical cord stem cells, intrathecally, you know, that's some spinal injection. And again, you know, kind of, you know, somewhat of a benefit, but not long lasting. So after about 8 years of practicing in the cosmetic surgery realm, vision continued to decline to the point where I wasn't able to drive safely. So decided, okay, you know what? I think I'm going to retire from the cosmetic surgery realm and really focus on finding some other root causes, because, you know, stem cells work the best in basically a milieu of the body that is optimized. So optimizing everything. So again, on this journey, even with the functional medicine, when I was a member of A4M, my focus was mostly on the aesthetics realm. So not learning all of the ins and outs of you know, deep functional medicine. So decided to really do a lot of courses in that realm. And one of the first things that I found was that I had total chronic fatigue syndrome, adrenal dysfunction, and I would say stage 3 adrenal fatigue, because after working, you know, so hard at these liposuction clinics and traveling back and forth pretty much every week, you know, fatigue set in, but I didn't realize how significant it was until I actually did, you know, a saliva test that showed how low my cortisol levels were, how low my DHEA levels were. So, and that of course also affects the strength of your immune system, because cortisol is a hormone that is very influential in controlling your secretory IgA. And the IgA, secretory IgA, is the main immunoglobulin in your gut. And as you guys probably know, 70 to 80% of your immune system is located in your gut. So, but that, again, you know, this is still kind of a journey. So that was one of the first things I learned. And then it took probably about a year or more being on, you know, some natural supplements, some adaptogenic herbs and all that stuff to kind of reboot that. You know, most of my labs, I would say traditional labs, were totally normal.
Michael, I have your labs up. You want to go over a couple numbers?
Oh, sure. So
the first one is the NMR lipoprofile, and your LDL particle number was the LDL-P was 1141, so it's considered moderately above normal.
Right. So if you're taking, you know, cholesterol numbers and so forth, cholesterol ultimately is not the enemy, so to speak. When we're doing these deep dive cholesterol numbers, we, beyond the HDL, which is quote unquote the good cholesterol, and the LDL, quote unquote the bad cholesterol, even though those really aren't cholesterol at all, they're protein carriers for cholesterol and so forth. But be that as it may, when you take the LDL and fractionate it out, if you have a lot of little small particles, then that could be problematic. And the reason is, so you should think about your arteries being, you know, smooth like Teflon on the inside. So in the presence of inflammation, you know, think of it as getting, little tears in it and uneven and all of these things. So one of cholesterol's jobs is to go to that site of inflammation and repair the damage that has occurred. So that is one of the reasons why cholesterol ends up in arteries, because you have an inflammatory process going on. And from a whole host of things, whether it's from what you're eating, toxins, infections, and all of these things. So, from a functional medicine standpoint, that's where, that's the importance, not just getting on a statin drug and lowering your cholesterol levels, because greater than 50% of the people who have heart attacks actually have a normal cholesterol level. So that should actually tell people that it's not just cholesterol. So, but that's an important point. But, kind of going along in my journey, and, at that point, okay, things weren't that out of whack. But then again, learning more about some of the underlying driving causes of inflammation. At that point, I know my homocysteine was elevated, and an ideal level is 7. But in traditional medicine, homocysteine normal can go up to like 18 before it's flagged. And high homocysteine levels are directly toxic to your blood vessels. So among other things. But again, just kind of think about it causing damage on the inside of your arteries. So again, cholesterol maybe coming to the rescue for that. My C-reactive protein was also elevated. And that's an indication. And at that time, I really wasn't in tune with the infections. So learning at that time more that the C-reactive protein was kind of a non-specific, marker for inflammation. But one of the things that could increase it is infections, right? But, totally normal white count and all of these things.
Michael, your white count when we ran the labs was 6.5.
Okay, so again, way in the normal range there. So again, not really of concern, and I didn't, feel bad or ever have fever, chills, any of these things. So some of the other things that I did at that point was stool testing, and again, way beyond what LabCorp Request offers. So looking at the imbalance of good to bad bacteria. So what we call dysbiosis, the presence of leaky gut, presence of candida, and parasites and all of those things. And I had a couple of parasites. I had the candida overgrowth, the yeast overgrowth in the stool and all of that stuff. And one thing to note, because I also did food sensitivity testing back then, and really ultimately found out that I was sensitive to gluten and to dairy. So probably about 8 years now, I've been gluten-free and dairy-free. Definitely noted a difference with bowel function, pretty much at least probably 30 days after really being regimented on that. But still, it wasn't the end all be all. So it was a good start, but there were other things that I needed to address. So I would say probably about 6 years ago, then was looking at, I'm really very into the summits, the health summits and so forth. And then one that came up was the Alzheimer's Summit, which Dr. Lewis was on, and that was the Alzheimer's Summit. And, of course, what really caught my attention was when he said glaucoma was Alzheimer's of the eye. So, you know, after reading the book and contacted him, basically wanting to know more about that. Yes, we kind of hit it off, and basically I ultimately became the corporate medical director for Real Health Clinics. But more importantly, found out that one of the things that I had overlooked in my journey was looking at the subacute infections. So such as Lyme disease, or, you know, Epstein-Barr virus, or chlamydia pneumoniae, or mycoplasma pneumoniae, cytomegalovirus, whole host of, you know, little.
You were high for Epstein-Barr, really high.
Right. So a whole host of little critters that can cause problems. And of course, Epstein-Barr virus is the virus that causes mono. So we've all been exposed to this, you know, as children and all of that. You know, your lymph nodes get swollen and what have you. So it's a very common occurrence. The problem, of course, with viruses is that generally when you get a virus, the virus stays with you forever. So it's incumbent upon your immune system to keep it at bay and stop it from replicating, kind of like with the chickenpox virus. But, you know, as you get older, a lot of older individuals get shingles, which is basically a reactivation of that chickenpox virus. So with glaucoma, that was what was elucidated by Dr. Trimp many years ago, as he was the only ophthalmologist that I had heard of that, and still I'm sure today, that actually started testing people for these subacute infections. And consequently, he was successful treating patients with you know, various antibiotics, you know, but long-term therapy, a year, 2 years, 3 years, 4 years, or longer, because these bacterial parasitic infections are very difficult to control. So I did start that regimen, was often on it. I actually had some side effects, and I think it was die off of the organisms too fast and so forth. So ultimately I decided to be on an herbal anti-pathogenic regimen, which I was a bit more successful with. But still, all along, again, this is a difficult journey when, you know, I've had glaucoma for many years, almost 30 years, and of course had the multiple surgeries. So I would say, you know, several other hurdles I needed to overcome to kind of control this.
Michael, let me ask you a question, because you talked about the difficulty, but also a simple test like the Western blot for Lyme will come out negative. In your case, you just have one band, the P41 band that was positive.
Right.
Want to just quickly comment on, you know, the traditional doctors would consider this negative, but.
Oh, absolutely. So yeah, traditional Lyme tests are, you know, if you have 5 bands or more, then you are considered positive. But again, the vast majority of people, you know, who get bitten by a tick and so forth, if you don't have the bullseye rash and you're not placed on the doxycycline regimen for 2 weeks and so forth, you know, most doctors really don't believe in chronic Lyme. They, you know, and I've had actually several patients, you know, who know what I do, and it's like, well, you know, I really think that my son, daughter, spouse have some symptoms of Lyme, you know, but they were bitten by a tick maybe 6 months ago or whatever. And they've gone into their doctor and asked for a Lyme test, and they were refused. So it's very, very interesting. So again, most people have to go outside of the traditional medical system, especially if they're dealing with chronic diseases, to dig deeper. So, and even with this, the traditional test from LabCorp, if it only comes up with 1 or 2 bands, that still means that you have been exposed to Lyme. So there's still a suspicion there. And there are other labs that are much more sensitive, again, not covered by insurance and so forth, but that is a key component. And Lyme is very, very elusive because it can, exist in several forms. And once it gets in its round body form, it's very resistant to antibiotic therapy. If anyone out there has, known anyone or gone through Lyme treatment themselves, with traditional antibiotics, it's a kind of a miserable journey. But there are other effective strategies. And again, it's once you have elucidated that, then it's still all about getting your immune system strong enough to keep these things at bay, because believe it or not, the vast majority of us walk around with one or more of these subacute infections in our body. It's virtually, I don't think we've done anyone and not found at least one, herpes, Epstein-Barr, something is lurking there. And even with the panel that we do, they're much bigger panels. You can do 25, 50 or more of these subacute infections. So we all carry these things around. And again, everyone expresses it differently. So one of the other things that I did was acupuncture. And I did about 3 years of that. I was seeing a doctor in West Virginia who specialized in eye diseases, no doubt, using acupuncture techniques, and actually had pretty good results for about 3 years with that. And he had a lot of patients. The problem was it was just a continuous thing. I did get improvement, but flying back and forth every month obviously got very expensive, and the treatment strategy was long, and I would have to stay there for a week to get the acupuncture treatments and all of that. But be that as may, I did notice some benefit to that regimen. So,
Michael, also up on the slide, I have the dendritic cells, the tenant, the microcurrent from Condra, if you want to comment on any of those.
Yeah, so did that for a number of years. So microcurrent therapy can also be very beneficial to stimulate neurogenesis or new nerve growth, because of course with glaucoma, you have death of the retinal ganglion cells, which, within the optic nerve and so forth. So I think I got somewhat of a benefit from that as well. But overall, I think for most people, as we go along in life, as we get older, we accumulate, more toxins. We are not addressing things. Glaucoma is a very, very insidious disease and very difficult to treat once it's far along. It's kind of almost like Alzheimer's. The earlier you get to it, the better to prevent, some of its downward spiral and so forth. But yeah, that was an interesting journey as well with the microcurrent and what have you. So,
Excuse me, I have one question, Dr. Carter. When you say that you had some improvement, like how did you see that improvement? Was it that the pressure, your glaucoma pressure went down, or what was the improvement?
So visual field, tests where basically, when you're at the ophthalmologist, you're looking, through this device where it's testing your peripheral vision. And I don't know if any of you guys have had that done, but there are little tiny beams of light that are flashed up on the screen, at random intervals and so forth. And you press a little, clicker to say, because you're looking, dead center at, at an image, and then you are not supposed to look around, and then, click when these things come up. Because ultimately you start losing your visual field. So everyone has a blind spot, but in glaucoma, then you get bigger and bigger blind spots at different areas of your whole visual field. So I would say the degradation slowed when I was doing a lot of these things. The thing that complicated my journey, though, was my pressures weren't as stable as they could be. So I was still running in the 20s, 22 and what have you. And even though that's normal for someone that does not have disease, for someone who has glaucoma, the goal is really to get you around 10 or 11 or 12, which is pretty difficult. And I was, pretty much on maximal, therapy for the drops. I've had multiple surgeries. I've had shunts and all of that, laser surgery. So I've had quite a journey just to keep the pressures down. I mean, thank goodness right now they run it, they run in about the 15 to 16 range in both eyes. So, from that standpoint, I think I'm pretty stable. So the goal now is really instituting the regenerative process to get things, improved. But other things that I found, after addressing, my homocysteine, getting that normalized, because of course that's an inflammatory, milieu, and the C-reactive protein, and getting that down, and being on the broad spectrum anti-pathogenic agents, and, being cognizant of the diet and all of those things, was to really find out what else was lurking. One of the other, subacute infections that I had was H. pylori. And H. pylori is actually it can be a friendly bacteria, or, medical terms, commensal, but if it's elevated, that is a bacteria that's implicated in gastric cancers and ulcers and all of that stuff. But it's also implicated in glaucoma. So again, and that's in the literature and so forth. So, but traditional doctors, never know anything about that. And of course, traditional doctors can only say, well, we could just put you on eye drops and offer surgery to stop the progression. We can't get any vision back for you. So that was another reason, of course, why I went down a different journey, learning these different things, because I know that there are ways to regenerate and so forth. Some of the other things that I found out was I had sleep apnea, and that was a surprise to me, even though I snored a little bit. But my wife never said that I stopped breathing, and it wasn't significant sleep apnea after, having a sleep study and all of that. But it was enough to, cause my oxygen saturations just desaturate a little bit, not tremendously, but again, think about it, from the brain standpoint, which, sleep apnea is one of the, causes of Alzheimer's. So if you're not getting adequate oxygen to the brain, and this is happening consistently, night after night, years over years, then your cells don't do well. So that was another thing that I had to address. Also found out that I had mold toxins in my body. So again, not necessarily living in a moldy house or working in a moldy environment. However, I used to go around with my dad, and we had apartments over on St. Simon's Island in Georgia. And those, had mold from, different things and what have you. So exposure over the years of that, and not even realizing it, but again, on my learning journey, how amazingly important mold toxins can be, and they can grow in you. You can actually have, people who suffer from chronic sinusitis and they take antibiotics all the time. 90% of the time, it's actually from fungus. So
just a quick point on the mold, because you introduced that to me, but we had that young lady at Hillenbrand with a severe polychondritis, which is inflamed cartilage from like here to here. And she went everywhere, Cleveland Clinic and everything, and they couldn't really solve the problem. But when you interviewed her, she had worked for like 9 months in a moldy basement, cleaning and painting. She was a painter. And then every spring, her flare-up, she'd have a flare-up of various degrees every month. It was really strange. Just every month, she'd have a couple-day flare-up. But in the spring, it was particularly bad, and we deduced that when the snows recede, she was up in Indiana, that certain types of mold are released into the air, and that would just be enough to trigger her event. And she's still under the care of Dr. Austin. It's a long, long journey, but at least we have her stabilized. She had developed a breast lump from the treatment and cataracts from the treatment where she couldn't see anymore. And, she couldn't get cataract surgery unless the flare-ups were stabilized. And we stabilized her enough that she could have cataract surgery and could actually return to work. So, but that was a clear case of mold inducing a very severe disease that you would normally think is a gut-related disease, but it wasn't. For the most part. It might have been a small component of it, but.
And again, that's not going to be picked up by your traditional doctor because they don't do mold testing. They have no idea what that is. So, so that journey, I found out that I had, high levels of different, mycotoxins. And again, not really feeling ill or anything like that. So, but these things are lurking underneath. So went on a, regimen to bind the mycotoxins. And again, supplements to enhance the liver detoxification, like glutathione and the various binders and so forth, because that is another long journey, a year, 2 years, 3 years to ultimately get this out of the body. I actually, went as far as to have a CT scan of the sinuses to make sure I didn't have any fungus balls growing. So I didn't, so that was a good thing, but a lot of people do. And that is a huge cause of Alzheimer's, huge, enormous. So, and that's, again, that's something that, traditional medicine has no clue. So another thing that I found out, I did a heavy metal test on myself, and that actually came back in a pretty normal range. But all of us carry around heavy metals, mercury, lead, cesium, arsenic, a whole host of things. And again, everyone is different in how they detoxify. One interesting thing, even though I've never had a cavity, never had silver fillings or gold fillings or anything like that, which of course is a, huge source of mercury. Younger years, I wore contacts. And the interesting thing that came out of that was, the solution that you bathe your contacts in had thimerosal in it. And thimerosal is mercury. So that was very, very interesting. So when you're doing heavy metal tests, of course, again, traditional labs like LabCorp or Quest, you can do a heavy metal test, but it only, measures acute toxicity. So other ways to do it are doing a provoke test to, try to push the metals out of the body, or whole blood analysis and so forth. And again, when I did that, I was still kind of in the normal range, but I never actually went back and did more provoking of that, because after really learning about, hey, any exposure, and especially, with the eyes, that's going directly to the brain. So I'm sure that I have mercury, that is a contaminant. And again, using the various supplements and so forth over years, it takes years to get heavy metals out of the body. You never completely rid the body of it, but it is a slow process. So that's another thing that, I'm working on. The gut healing, that's critical. Having leaky gut, and, I verified that using, the more advanced tests showing that zonulin is increased and having increased the lipopolysaccharides, which come from basically the gram-negative bacteria in the gut. Again, kind of going back to that dysbiosis, having an imbalance of good to bad bacteria. So being on, the right probiotics and, switching them up, kind of going back and forth between, really high quality brands, using serum immunoglobulins to help heal the gut, and glutamine and a whole host of things. So it's been quite a journey for me. I mean, I would say the most rewarding thing is along my journey of trying to assess what's going on with me. I've been able to build up a very nice practice to help others with all of their chronic diseases. And of course, with the specialization in Alzheimer's and Parkinson's dementia with Dr. Trimp and Dr. Lewis. And then I also was trained by Dr. Dale Bredesen, who wrote the second book, The End of Alzheimer's, and really classifying the Alzheimer's into 6 different categories. And those 6 different categories really apply to a whole host of, disease entities that we can potentially suffer from, So I would say most importantly, people need to really, whatever that they're dealing with, first and foremost, let's say type 1, cause of Alzheimer's is from inflammation. So you want to, just like we do with our platform, in a very inexpensive, yet concise way to elucidate, those inflammatory factors. Is your homocysteine up? C-reactive protein, uric acid, is your insulin level high? Fibrinogen, a whole host of things, because we need to be at an optimal level to have, great health. So that type 1 inflammatory, there are a whole host of things that are going to drive that, such as subacute infections, such as eating a bad diet. Everyone should strive to eat as organic as possible. And I'll be honest, I don't eat all organic all the time, but I'm very cognizant of that fact. So when I'm eating, I really do try to, when I'm cooking at home, everything is organic, but when I'm out, it's a plus or minus, but I'm also taking, supplements that's going to help me detoxify and all of that. One of the critical things, of course, is, non-organic fruits and vegetables are sprayed with Roundup, and the active ingredient of that is glyphosate, which we all probably have heard is, connected with cancer. But, on a lower level, it causes leaky gut and a whole host of, detrimental effects on the body. And again, it all kind of goes back to, is your body able to detoxify and get this out of the body? And everyone's on a different continuum. But that was a test that I did on myself. And I found out that I had a very low level, because all of us have been exposed to glyphosate. It's water soluble, unfortunately, so it's everywhere. Even if you eat organic, you're going to have it. So, but a good thing to do is test to see where your level is. And if it's elevated, you definitely need to change the diet and use supplements that's going to help bind that and get that out of the system. Another thing is being cognizant of the toxins. There are tests where you can get a whole host of biomarkers that tell you, with all of the pollutants in our environment, if you have high levels of those. So again, I tested myself and, I was actually low on that level. But again, these are things that, cause inflammation and degradation and all of that. So the next one in the Alzheimer's realm, again, but think about it in the, whole body realm, is type 1.5, and that's glycotoxic. So we know we have an epidemic of diabetes, tons of people are diabetic or on the pre-diabetic regimen, probably greater than 60% of America is on that, if not more. But we now know that type 3 diabetes of the brain is another cause for Alzheimer's, which is why Alzheimer's is now the third leading cause of death. We have 40-year-olds getting Alzheimer's now. So it's very disturbing what's happening. So everyone really, that's why Dr. Lewis and I are so passionate about our platform, because it can be administered to anyone at any age, and you can see some of these underlying inflammatory markers that are taking you down the wrong pathway. Type 2 would be a decrease in hormones, especially for women, decrease in estradiol, in men, decrease in testosterone, decrease in cortisol. So, and everyone has some degree, and especially as you get older, these hormones start to decrease. Things that can affect your hormones are being on like a statin drug, to lower your cholesterol. Well, guess what? Cholesterol is the building block for all of your hormones. So cholesterol can go up for certain reasons. Let's say your hormones are low. So your body is trying to help you. So if you artificially lower your cholesterol with a statin drug, you're doing your body a great injustice. So that's another realm to really look at. Type 3 is on the Alzheimer's realm is toxic. So we go back to the heavy metals. If you have dental amalgams, silver, gold fillings, 50% of that is made up of mercury. So, and again, if your body can't detoxify, then that mercury is just building up, and especially in your brain. Other toxicants, would be, the environmental toxicants and other things, and also the toxins that come from mold. Type 4 would be decrease in blood flow. So from cardiovascular disease, and especially, of course, for eye diseases, because you think about the cardiovascular disease in the big vessels, but it always starts in the small vessels. So, and that is really key, to elucidate. I always tell my female patients, especially the older female patients, because, there's such a push to decrease the risk of osteoporosis. So lots of women are taking calcium supplements. Well, that's really a problem, because that ultimately just ends up in your arteries. And it's further compromised by, at least, the traditional doctors know about vitamin D deficiency, at least some of them, not all of them, and they're testing people, but they're putting patients on 50,000 IUs once a week. Problem with that, okay, yes, that's going to increase your vitamin D level. But if you're a woman and you're taking extra calcium, and let's say that doctor didn't tell you that you need adequate levels of vitamin K2 and magnesium to make sure that that calcium goes all the way to your bones or your teeth where it's supposed to be, then it actually ends up in your arteries and in your kidneys and in the tendons and so forth. So traditional medicine is actually inadvertently creating another epidemic of cardiovascular disease in men and women, but especially women who take extra calcium. So you really should not be taking calcium supplements. You really should be getting it from your food. And when you take your vitamin D and your K2 and your magnesium, you'll have sufficient levels of calcium. And I also encourage people to do, a calcium heart score to see how much calcium is built up in the arteries. of the cardiovascular system, because again, it's not all about cholesterol. So when you see, if your score is greater than 0, and that test is actually not that expensive, and most insurance will cover it, but if not, it's about $150. So that's a really, really good test to kind of assess where you are with calcium buildup in those.
Michael, if someone has a pretty good coronary calcium score, could they still have small vessel disease?
Oh, absolutely. So kind of, again, looking at our panel. So looking at your homocysteine, looking at your C-reactive protein, looking at your RDW, the red blood cell distribution width. So again, that's a common lab, on a traditional doctor's panel, but they don't interpret it, in the best way. So we know that a red blood cell distribution width above 12.5, 13 indicates that, those really tiny vessels are getting clogged, because the red blood cell distribution width, it's kind of what it says. So those red blood cells have to flatten out more than normal, because the red blood cell is bigger than a capillary, right? So they have to, the red blood cells, to get through that, they have to kind of distort anyway. But the more they have to flatten out like a pancake, the more it tells us that there is something that is impeding the flow. And again, we go back to, why is that being caused? Is it buildup of calcium? Is it an inflammatory process? Is it an infectious process? And that's another reason why cholesterol increases. God made that for a reason. It's actually very antibacterial. So again, we are in the traditional medicine lowering something that can be very healing to us. So, so looking at that, the SED rate, the sedimentation rate, if that number is high, then again, that is telling us there's a lot of inflammation and potentially, problems with the small vessels. And fibrinogen, another really, really key one, especially, in this coronavirus, where we are having individuals having blood clots and all of that. Again, that's not a normal blood test that you would get on a traditional panel, even though, of course, they can order that, but that's not something that they normally get. But
Michael, I'm just throwing up a paper on the screen that I'm sharing, something Dr. Tremp showed me. The title is Cholesterol as a Treatment for Pneumococcal Keratitis, Cholesterol-Specific Inhibition of in the cornea, if I could pronounce that, pneumolysin in the cornea. And Dr. Trump's method, comment on the top is, cholesterol is very good. It kill. He always had his S's backed up, being French Canadian. It killed bacteria. But anyway, so anybody doesn't think that cholesterol is antibiotic, it would be blasphemy to treat your eye with cholesterol, but it would probably be one of the better things you could use.
Absolutely. So yeah, I'm still on my journey, of course, taking various supplements, obviously with the coronavirus, making sure, I'm taking my liposomal vitamin C, my cod liver oil, my D at, 3,000 to 4,000 IUs a day. I'm taking vitamin K2 at 300 micrograms. And the research does show that the vitamin K2 at that level over, time can really improve arterial elasticity and decrease the calcium deposition. Magnesium, doing probably about between 400 and 800 milligrams of elemental magnesium a day. The zinc at 50 milligrams a day. I'm also taking quercetin. Nice thing about quercetin, which is actually how, with the controversy of how hydroxychloroquine works in treating the coronavirus, is that hydroxychloroquine works as an ionophore. An ionophore is something that allows the cells to open up to allow substances to get in them. And in this situation, it's zinc. And zinc actually is very, very antiviral, so it can stop the replication of the virus. But again, most people are deficient in zinc, like they're deficient in vitamin D, like they're deficient in magnesium and C, and all of these things, and those are very, very critical in the competence of your immune system. But quercetin is a flavonoid that works like hydroxychloroquine as an ionophore. So quercetin has a lot of its own attributes, but one of the key ones when it's working with zinc is it allows the zinc to get into the cell so that it can exert its effect. Selenium, also a really important supplement as well. So as a baseline, those are the things that everyone should be on daily to enhance your immune system, because, you know, at the end of the day, everyone obviously is ultimately going to be exposed to this virus, but keeping your immune system competent, you know, will obviate the need to be, let's say, worried about the virus. Now, if you have, you know, significant cardiovascular disease and diabetes and high blood pressure and all of these, yeah, you're actually more of a risk. However, you know, with our program, you know, we can show people how to reverse all of those things in a reasonable time frame as well. So again, you know, with the journey that I've been on, it's taught me a lot about myself, you know, and a lot about, you know, treating other patients. But I mean, you know, as you can tell, both Dr. Lewis and I are very, very passionate about educating people. We are, you know, consummate readers and listeners of information on pretty much a daily basis, and trying to deliver that information to our network of people. So, but I wanted to, you know, just kind of share that to let people know that, you know, I've been through a very circuitous journey. You know, God has taken me through, but I think God took me through that, you know, to be here, really, to not just, you know, excel in anesthesia or cosmetic surgery, but more so, you know, what is most important is really spreading the word that you don't have to be on a lot of medications. And if, yes, sometimes you do have to be on medications, but the goal is to try to lessen those, but to really put you on the pathway so the body can ultimately do what it's designed to do, and that is to heal itself. So, any questions?
Thank you, Dr. Carter. Any questions?
Can I ask you about your mold issues? How long did it take you to resolve the mold, the mycotoxins?
I'm still on that journey. So, so basically, you know, I'm using various supplements like Espelarti. So, and it also depends on the mycotoxins that you have. You know, they can be classified into many different categories, like trichophosines, you know, there's just a whole host of these mycotoxins that are liberated by different mold species. So I, you know, I tested my house and found that I really, I did have Candida.
Did you use an ERMI test for your house?
So I didn't use the ERMI, I used the plates. So yeah, I used a company called Immunolytics, and I found that to be pretty illustrative. So you know, you take these little petri dishes and you put them in strategic locations of the home, and open it to air for an hour, and then send it back, and then they tell you what is growing out. The ERMI is, you know, it's a beneficial test as well. But what I found to be most illustrative, though, is really actually doing a mycotoxin test, and to find out what is actually coming out of your body, right? So, and using a provoking agent like glutathione, which will help, you know, push that out. Because I actually did 2 tests. So I did it, you know, without doing the glutathione, and I had a certain level, mycotoxins, and then a week later I did another test and found out that I had even more mycotoxins coming out. So again, it's a journey, and I did this probably about a year ago. So I'm taking the Pylori. I really like the GI detox from Biobotanical Research. Quicksilver also has a really nice binder. It's called Ultra Binder. So those are, kind of broad spectrum, multi-component binders. If you're, familiar with, mold toxicity, yes, it is quite a journey. 25% of the population actually is very sensitive to mold, and they don't necessarily know it. So you can do genetic testing, and that can elucidate. But again, at the end of the day, if again, it can manifest as multiple disease syndromes. So if you've been on a journey doing a lot of different things, and that is not one of the stones that you unearth, then that is one to check out, because mold is everywhere. Really, so you can't get away from it. So what you want to find out is if you have a lot of it in your body and can't detoxify it.
Right. And did you use real-time labs for your mycotoxin?
I did. I use real-time labs, and I also use Vibrant America. So Vibrant America also has a very, very good test for the mycotoxins. Great Plains Labs also has a good mycotoxin test. Those are the main 3 labs out there. But
yeah. No, and I've done it as well, and I had high levels. I did an ERMI test for my house, which came back. There's probably an issue. You don't have to move out. And then I had a mold inspector. I had my basement done, and I'm in a bit of a low-lying thing, so there's mold on the outside of everyone's home in my neighborhood. Right. So no matter what, it's going to be there. But anyway, so I did all that. I did the Shoemaker protocol. I did cholestyramine. I did the GI detox. I did bentonite clay. Okay. I ended up on amphotericin B, blah, blah, blah. Anyway, for over a year. But after a year, I retested, and I had 4 mycotoxins that were high. They went higher. So I was just wondering if you had a similar result.
No, they will go. So again, it's getting rid of mycotoxins is like getting rid of heavy metals. It's a 2, 3, 4, or 5 year journey. So, and again, it's dependent on what are your symptoms. Are you symptomatic from anything, or Yeah.
Now I don't have sinus issues, but I did have a CT scan of my face. Would anybody notice if there was fungal growth in there, like the oral surgeon?
So I work with a doctor here in Atlanta who is an ENT surgeon. But he specializes in mold, because he's mold toxic. His name is Dr. Donald Dennis. And, he's well known in the mold universe. So, and he reads the CT and MRI scans differently from the traditional radiologist. So again,
I could have something there maybe, but yeah.
Well, again, if you have chronic sinusitis,
I don't.
Okay, all right. Yeah. So, but you can still have fungus balls, but maybe not. But again, this is still a journey. And using the nebulized amphotericin B and all that, that is a way to do it. I didn't do that. Again, I just use most of the other binders, using glutathione on a daily basis. And I haven't retested yet to kind of see where I am, but I kind of know it's just going to be a journey. I mean, I feel good. I work out all the time. I do P90X, so I don't have any fatigue issues or anything like that. So I just know that I'm just going to have to keep doing this, because my end point is the resolution of my eye issues. So we can't stop doing different things until I remove all of the interferences, so that the neurogenesis can ultimately take place. But again, most people are a bit impatient. And I was impatient when I first started this journey, but I know that I really have to stay on these multiple regimens for, a long, long time.
Yeah.
So,
Interestingly, I see a functional medicine doctor, and after the second test, I don't know why. I mean, I had some other issues going on. I fractured my hip, blah, blah, blah. But he just stopped the mold treatment. He's like, in my mind, didn't really come out and say, well, I don't think it's working, but he just kind of went, oh, well, let's just stop this. And I just was curious as to how long, I would have stayed on it for a long time, but
yeah.
I was on the cholestyramine, so that may be more severe.
The cholestyramine, I'm not a big fan of that. Yeah. The bile acid binder and cholesterol binder and all of that, that is one way to do it, but I think there are gentler ways to attack that. And again, the GI detox of the ultra binder, along with Estelardi. But glutathione is key in that. So, I mean, you really kind of want to know, what your liver function is looking like, and just doing the binders is still just one piece of that mycotoxin, puzzle. So,
Sure.
Yeah.
It's complicated.
It is very complicated.
It is.
It's a long journey, but it's been fascinating to me. And like I said, I can, share my experiences with patients and kind of help them along their journey, but also to give them motivation when they, get upset. It's like, it's been, 3 months, 6 months, and I still don't see anything. It's like, well, I've been on my journey for years and I'm still on it. So that provides, some little comfort for some of them. For
Sure.
For others, it just depends. But and again,
I mean, everybody's different,
everybody's different. Everybody's different. Yeah.
I'm like-minded to your approach. I think it's really, it's a lifestyle. So
Yes,
it's
absolutely,
good.
absolutely. Yeah.
Any other questions?
Sorry.
That's fine. All righty then, Dr. Carter.
Okay.
Thank you very, very much.
Thank you, Dr.
Back
Carter.
on Tuesday evening.
Thank you. Absolutely.
Bye now.
Okay.
Bye.
Bye bye.
Thanks.
Uh-huh.